Good afternoon, everyone. I am Varsha Shrivastava from Bladder Wellness team. I hope you all are keeping well. Please vaccinate yourself and wear a mask when in a public place. Today we are here to talk about urinary incontinence or overactive bladder. Overactive bladder is a sudden urge to pass urine, which is difficult to control. The condition is common and distressing and may have a huge impact in the quality of life. In this month of World Continence Week, let's unite to raise awareness about incontinence related issues and its impact in the life of people living with it. To throw more light on the subject and guide us on what is right for diagnosis and treatment of urinary incontinence, today we have with us Dr. Venkat Subramanian sir. It gives me an immense pleasure to introduce Dr. Venkat Subramanian sir with us. Dr. Venkat Subramanian is a senior consultant urologist at R.G. Stone Urology and Laparoscopy Hospital and Shakti Hospital and Research Center, Chennai. Sir has a rich experience in the field of urology and the experience is more than 15 years. And he makes sure that he carries out the treatment with utmost precision and efficiency, ensuring that the patient's health are in safe hands. Sir, it's a pleasure to have you in our show. We welcome you, sir.
Thank you, Varsha, for the kind introduction. Happy to be here.
Thank you, sir. There are many questions that our viewers would like to know. So first, I'll start with what is urinary incontinence?
Yeah. So basically, by the word continence, we mean the ability to control. It's just not the urine, as well as both the bowel and the bladder. So it is a basic right of a human being to evacuate both his bowel and the bladder at his own will. If one loses the ability to control it, then we call the person as incontinent, as being incontinent. Now, incontinence is a very socially distressing issue. Yeah, so that is why we are here to discuss this issue in detail, and let's go through it.
Yes. So, sir, what are the types of urinary incontinence that we go through?
Right. So, being a urologist, we will discuss about the urinary incontinence today in detail. So, urinary incontinence is of three main types. So, one is called as the urge urinary incontinence, where you have the sudden urge to pass urine which you're not able to control, and you leak urine. So, that is urge urinary incontinence. The other type of urinary incontinence is called stress urinary incontinence, where any stress like coughing or sneezing or laughing out loudly, those kind of activities cause an involuntary leakage of urine. So this is called as a stress urinary incontinence. And there is a mixed urinary incontinence where patients experience both this urge and stress urine incontinence.
Okay, so there are different types of urinary incontinence. And sir, who are more prone to this disease actually?
So incontinence is basically a condition. I wouldn't call it a disease. Okay. It can be secondary to an underlying disease condition. So primarily, if you see statistically, women are at least twice more affected and seem to experience incontinence than men.
Okay.
So it is the women who have, who seem to have urinary incontinence more than the men.
Okay. So as compared to female, the men are supposed to have it more. And what about the elderly patients or even the adults? Who has it more?
Okay, so if you consider the age group, certainly the incidence of incontinence is more in the elderly age group. Okay. So if you take women, it is the post-menopausal women. That is, once they attain menopause, they are more prone for having urinary incontinence. Even similarly, in males, it is the elderly age group population who tend to experience urinary incontinence, but it may not be a primary urinary incontinence. It may be secondary to conditions like a prostate enlargement, and because of that, they may have a secondary urinary incontinence.
Okay. So you just now mentioned about prostate. Could you please elaborate it further? What is prostate actually?
Yes. So a prostate is a walnut-shaped organ which is located in the base of the urinary bladder only in men. The women don't have prostate. Yeah. So prostate is essentially an accessory sex organ which helps in the production of semen. So what happens in elderly age group is the prostate tends to enlarge in size, causing bothersome urinary symptom. One of it is urinary incontinence.
Okay. So how do we know that we have got urinary incontinence? What are the symptoms that we can have?
Okay. So by definition, urinary incontinence means an involuntary loss of urine control. You are not able to control your urine.
Yes.
But there is a collection of symptom complex, which we commonly refer to as overactive bladder. So basically, there are three common symptoms which one would attribute to an overactive bladder. The first being an increased frequency. Patient would have to pass urine more than the normal, frequency that one tends to pass urine. So normally, if you see, an average human being passes urine about 4 to 6 times in a day. Anything more than 8 to 10 times we call as increased urinary frequency. And this happens more in the night, we call it as nocturia. If one has to get up more than twice in the night to pass urine, we call as nocturia. So increased frequency is the first bothersome symptom which a patient will experience when he's having overactive bladder. The second being urgency. So in addition to the increased frequency, the patient will have a sudden urge to pass urine. So once he gets the urge, he may not be able to restrain the urge for a longer time, and he'll have to run to the restroom to empty his bladder. The third one, a more severe part, is the urinary incontinence. So not only does he have urgency, but he's also tends to leak urine even before reaching the washroom. So these three symptom complex together is called as overactive bladder.
Okay. So I hope our viewers will keep all these three symptoms in mind. If you have any one of these, then you need to consult a urologist. Okay. Sir, what are the food items that we should avoid and that cause urinary incontinence?
All right. So like you rightly pointed, lifestyle modification plays a very important role in controlling urinary incontinence. So first and foremost, when a patient seeks medical attention, we try to categorize them as whether they have a primary urinary incontinence or a secondary urinary incontinence. Now, these lifestyle modifications that we're talking about holds good, particularly for the primary urinary incontinence. Probably we'll look into the primary and secondary in a little bit more detail. But answering your question, when it comes to lifestyle modification for a primary urinary incontinence, it includes, if a patient is overweight, losing weight definitely helps in gaining better continence. And if you take foodstuffs, avoiding carbonated beverages, avoiding caffeinated beverages definitely tends to decrease the urinary frequency, because these are all supposed to be bladder irritants. Alcohol is a major bladder irritant, so is smoking as well. So these kind of lifestyle modification is very essential for a patient who is experiencing urinary incontinence. Okay.
So these lifestyle modification you need to do, and these food items and all these fluids you have to avoid. Sir, you have mentioned about caffeine intake. So should a person completely stop drinking coffee, or 1 or 2 cups are okay in a day?
See, not all patients who drink coffee seem to experience this, So certain patients who tend to have a propensity to have an overactive bladder or urinary incontinence, they should identify specific things which seems to trigger this incontinence, and they should avoid. So this particular group of population, if they find that drinking caffeinated beverages does seem to, increase their incontinence episodes, they should definitely restrict the use of caffeine.
Okay. So if you are having the symptoms of urinary incontinence, then automatically you will have to understand that you have to reduce or stop the usage of caffeine. But as prescribed by the urologist. Sir, there are some people who just Google the symptoms and try to become their own doctor. So what would you like to tell? What is the message from your side to these people?
Google is good. At least, they try to know that something in their body is not right. But Googling can be, a very, can cause a lot of mental agony, because they don't seem to think simple and straight. The first question that they will come, am I suffering from cancer? So, even though urinary incontinence can be a symptom of cancer, but that's very rare. So my suggestion to Googlers is, once you seem to experience incontinence, you should visit a physician, or in particular a urologist, who sees this set of patients day in and day out, and he will help you in sorting out your symptom, try to find out the underlying cause and give you a solution for it.
So I hope the message is clear. Please consult a urologist and don't Google and just try to become your own doctor. Okay, that is there. Sir, I was talking about the food related items that we should avoid. Now my question is, what food related items should we include in our diet that will help us in order to get rid from urinary incontinence?
So, Varsha, actually, we discussed just about the food. We didn't discuss the lifestyle component as a whole for a patient who is experiencing urinary incontinence. Those modifications, food is only one part of it. The first and foremost is their fluid intake. So one needs to know the kind of fluids other than the caffeine that we discussed that they are taking. So that regard, when they consult a urologist, he will ask you to maintain what is called as a bladder diary. So a bladder diary basically means the patient should record how much fluid, be it water or whatever fluid that he's taking. He needs to note that down at what time and how much quantity he's taking, and also the time interval at which he's using the restroom, and if possible, record the amount of urine that he's passing. Now, this data helps the urologist to understand whether it is true urinary incontinence, or is the patient having, taking too much of fluid, which is causing him to use the restroom often and experience incontinence episodes. So fluid management is a very important lifestyle modification which a urologist would advise in a patient who's having urinary incontinence. Next comes the food habits, which we have discussed. Now, to answer your question specifically, there are no particular recommended food which can, completely prevent urinary incontinence. We generally recommend a diet which is rich in fruits and vegetables, and a vegetarian diet is much better as compared to a non-vegetarian diet. Basically, junk food is a no-no, and carbonated beverages and caffeinated beverages is a no-no, or particularly in patients with OAB or urinary incontinence.
Okay. So obviously fruits and green vegetables are always helpful, but junk food, that you all must avoid. Okay. Sir, when it comes to drinking water, how much liters would you like to recommend?
Okay. So the normal advice which a urologist would give for a normal set of patient who wants to know how much urine he needs to drink is, the color of the urine is the right indicator. So we basically advise that if even though the normal urine color is straw yellow, we advise that if the color of the urine is the same color as the color of the water that you drink, that means you're well hydrated. But this doesn't particularly hold good for a patient who's having overactive bladder symptoms, because those patients should restrict their fluid intake, particularly in the evening. So post 6 p.m., we generally don't advise too much of water intake for this particular set of patients. And particularly before going to bed, some people have the tendency of drinking a lot of water and going to the bed. So that's a no-no for a patient with urinary incontinence. We generally advise them to empty their bladder just before hitting the bed, and advise them not to drink water before going to bed. And even if they have to get up in the middle of the night to pass urine, again, some of them will come back after emptying the bladder and take more water. That's again a no-no. It's better not to drink water, or if you feel the throat is dry, you could probably sip a very small quantity of water just to moisten your throat, or you could just gargle it out and instead of taking too much of water once you come back from the washroom.
Okay. So this is advice, and it differs from patient to patient. Okay, that is there. Sir, now I'll take a question from one of our viewers, and it is by Rahul Singh. He's asking, are there exercises that can strengthen pelvic floor muscles to help with urinary incontinence?
That's a very important question, because in primary OAB, and even in patients with stress urinary incontinence, the strength of the pelvic musculature plays a very important role in maintaining continence. Now, if you see, we already discussed that women are more prone to experience urinary incontinence. That is because they have some specific events which only a woman undergoes, like pregnancy, childbirth, and menopause. So these are all events which are particular to women, which can cause weakening of the pelvic floor musculature because of the pressure of the gravid uterus on the bladder. And sometimes in women who have multiple deliveries, prolonged labor, these things can all cause weakening of the pelvic musculature. So to answer the question specifically, Kegel's exercise is the most important exercise which one can practice to strengthen the pelvic floor muscles. So this includes practicing to tighten the muscles around the motion passage as well as the bladder muscles. So it is very important that there are many video tutorials available in YouTube, because it is very important to exercise the right set of muscles. Because in trying to do Kegel's exercise, one might contract the lower abdominal muscles or the thigh muscles or the gluteal muscles, the buttock muscles. But these are not the muscles to be involved in the Kegel's exercise. It's the periurethral and the perianal muscles or the pelvic floor muscles, which needs to be specifically tightened.
Okay. So this is what sir is suggesting. I hope, Rahul, the answer is clear. Okay. So taking the next question, and it is by Manoharan. He's asking, does incontinence leads to UTI?
No, it's actually the other way around. So if a patient has got urinary tract infection, he will have what is called as a transient urinary incontinence. So usually, whenever a patient comes to a urologist saying that he's having incontinence, we usually go through the history in detail. So is it for a short duration, or is the patient having the symptom for a longer duration? And we also ask for other symptoms associated with urinary incontinence. And post the history, a simple test like a urine routine and a culture test will give an indication whether a patient is having urinary tract infection. So patients with urinary tract infection will experience a transient urinary incontinence, but once the infection settles down, it usually disappears.
Okay. So it is the other way around, actually. Okay. Sir, now taking the question from Shivani Mishra. She's asking, how do we diagnose incontinence or overactive bladder?
Okay, so the diagnosis is actually quite straightforward from the patient's words itself. So the patient will come to the doctor saying that he or she is not able to control urine. So we just take it from there, and depending on the patient's age group, we start asking other types of questions and try to find out what is triggering this or what is causing this patient to be incontinent. And so the diagnosis can be made based on the patient's history primarily. And then we do examine the patient to rule out a stress leak. So this can be easily elicited in the examination couch when a patient is asked to cough and the patient leaks urine, then that is very clear of a stress urinary leak. We do certain specific tests to diagnose the underlying condition. And ultrasound is a very useful tool which gives a very useful information about the patient's bladder and even about the kidneys. So there's a parameter in the ultrasound which is called as post-void residual urine, which indicates to the doctor how much urine is being stored back in the bladder after the patient empties urine. So because one type of incontinence is called as overflow incontinence. So basically the patient is not passing urine, he's in urinary retention, and he's just leaking some amount of urine like a tank which is overflowing. This particularly happens in an elderly male patient who's having urinary retention secondary to an enlarged prostate gland or a bladder outflow obstruction. So that is again one type of incontinence which we try to rule out. So basically from the history, examination, and simple tests like urine analysis and ultrasound will usually give the diagnosis of urinary incontinence.
Okay. So this is how we'll diagnose it. Okay. Sir, what is the treatment actually? Is it really curable via medicine, or we have to even go for the surgery sometimes?
Yeah. So primarily urinary incontinence in most cases is completely curable. Yeah. So like I already mentioned, we need to categorize it as primary or secondary. Why this categorization is important is, if the urinary incontinence is secondary to an underlying condition, for example, it may be a simple urinary infection, or like I mentioned, in elderly men, it can be due to enlarged prostate gland, or it can be due to an underlying neurological disorder, even though that set of patients is quite less, but it can be a very significant problem, or even this incontinence can be a useful symptom to diagnose an underlying neurological condition. So it is very prudent to identify what is causing the urinary incontinence And if it's a secondary urinary incontinence, you have to treat the primary problem, which is led on to the urinary incontinence.
Okay.
And if it's a primary urinary incontinence or a primary overactive bladder, which is most often idiopathic, you may not able to find out any underlying cause, and most of the investigations and tests also will be normal. So in such cases, we tend to start the treatment from lifestyle, behavioral changes, and food modification. And then we also give them pharmacological treatment. There are very simple medications which we can give, which can really give a lot of relief to the patient from the symptomatic point of view. So, and only when medicines don't seem to work. So these medicines won't work overnight. You'll have them starting from a month's time, and some of them may take even up to 3 months for the entire effect to be in place. So these medicines usually are given for a longer period of time. And if patient doesn't experience a good amount of symptomatic relief in spite of medications, then comes the more sophisticated and complicated treatments like we have Botox injections, which can be given into the intravesically through a simple cystoscopy procedure, and so on and so forth. So in most cases, it is treatable completely by simple medicines.
Okay. So this is a good thing actually, that it is curable by medicine, and if not, the surgery option is always there. Okay. So sir, the medicines that has been prescribed by the urologist, are there any side effects?
So we have come a long way as well as the pharmacological side effects of these group of medicines are concerned. So yes, so some of the common medicines, what we call as the anticholinergic group of medicines, does have some minor side effects like a dryness of mouth. In an elderly patient, they might experience constipation, and there's a minor side effects which can happen. A little elevation of blood pressure in a hypertensive patient. These are very minor side effects, but by and large, most of the patients are quite, they're able to tolerate these medicines well. And there have also been newer advancements, a newer group of medicines like mirabegron, where the side effect profile is also much, much less. So one need not worry much about the side effects, because the effect of these medicines on the overall well-being is far more superior than the side effects.
Okay, so there is side effect, but there is a solution for that side effect as well. So there is no need to worry. Okay. Sir, taking the next question, and it is by Rekha Shukla. She's asking, does smoking has anything to do with the OAB? We have already discussed it, but once again for our viewer.
Yeah. So smoking is a definite, nicotine is definitely a bladder irritant. And, nicotine or smoking is one thing which affects from head to foot. So why would one really want to, it is definitely prudent to quit smoking. And as far as bladder is concerned, not just urinary incontinence, overactive bladder, there is more association of bladder cancers and urinary tract cancers, which is primarily related to smoking. So as far as your kidneys and urinary system well-being is concerned, smoking is a definite deterrent.
Okay. So smoking has many side effects, and one of this is OAB, of course. So you have to quit smoking or be very careful with that. Okay. Taking the next question, and it is by Amitesh Tiwari. He's asking, how many chances of OAB are there in youngster between the age of 20 to 30 years?
Okay. So we were discussing primarily the urinary incontinence which happens in postmenopausal and elderly age group. So there is a set of young and middle-aged women who will experience this overactive bladder symptoms, and they are usually quite alarmed by it. But one need not be alarmed by it. It is quite common to have overactive bladder in the middle-aged group. It usually lasts for a very small period of time, and it is completely curable and by course of medications. If it happens in a very young age group, we'll have to rule out a secondary cause which is inciting it. For example, in the case of males, there could be a bladder outflow obstruction or a stricture of the urethra. So these things can also cause urinary incontinence, or an underlying neurological condition has to be ruled out. Like multiple sclerosis and meningomyelocele. There are certain conditions which can be missed in the young age group, and these can manifest as urinary incontinence in the second decade of life.
So even the youngsters can have it. So what about the children? Can they also suffer from urinary incontinence?
Yes. So children also can have urinary incontinence. In fact, it is a mother has to closely observe the symptom in a child, and if is having frequent bedwetting, and particularly if the patient has had bladder control, has stopped passing, has stopped bedwetting, and again started to wet the bed at night. This needs to be an alarm needs to be raised, and the mother needs to bring the child for evaluation. And
Okay.
more important to be emphasized is bladder training in these young children. They tend to store their urine for a much prolonged period of time because of very many reasons. Right now we are in the era of digital education, but in schools, some of these children may not feel comfortable going to the restroom, using the common restroom, and they may tend to store urine for a longer period of time, which is very detrimental to their bladder well-being. And some children who are genuinely having this frequency and overactive issues, they may feel they may have the fear that the teacher will reprimand them for wanting to use the restroom, and they will tend to kind of control the symptoms. So the awareness should be 360-degree. It should be both from the family point of view and from the public point of view, and these children should not be chided for if the symptoms are genuine, or rather the teacher should be a person who should alert the parent that their child is experiencing these symptoms and it requires medical intervention.
Yes, of course. Not just the child, the parents, and even the teacher need to be really careful if the child is showing such symptoms. But there is no need to worry because the chances are relatively less as compared to the elderly patients, of course.
Certainly.
So, yes. Okay. Sir, taking the next question now. Can pregnant lady can also have urinary incontinence?
Yes, pregnancy is certainly a state where women might experience urinary incontinence. This can happen in early pregnancy as well as in later on in the pregnancy because of the enlarged gravid uterus, which presses on the bladder. The patient might have urinary incontinence. Like I already mentioned, if a woman has a normal delivery, even if the labor is prolonged, that can also cause urinary incontinence later on in their life. So usually, by and large, pregnancy, yes, is a state where women will experience urinary incontinence, but it's usually transient. It usually settles about 4 to 6 weeks after delivery. If it doesn't settle beyond that period, a woman needs to come out and seek medical attention. Having said that, one way of preventing this is now a lot of rehabilitation programs are happening for pregnant mothers. Like, there are yoga for pregnant mothers. And one important thing is this Kegels exercise that we discussed needs to be practiced by all pregnant mothers and should be continued even after delivery. That can prevent or control these incontinence episodes to a large extent.
Okay, so there's a solution for this problem as well. Pregnant ladies may have urinary incontinence, but the solution to this problem is also there. Okay, sir, what about the patients who have obesity? Are they also prone to this disease?
Yes, there is an increased incidence of overactive bladder in obese individuals. So again, if you look at it, obesity doesn't happen overnight. So all the unhealthy habits that we discussed, like junk food and beverages, carbonated beverages, alcohol, usually a few of these precipitating factors would have also caused obesity. So definitely modifying their lifestyle and losing their extra weight will definitely help in bringing the urinary incontinence under control.
Okay. So there are many treatments possible for this urinary incontinence. Sir, can yoga and meditation also help to cure this?
Yes. So relaxation techniques have been proven to control this incontinence episodes, because like I discussed, primary overactive bladder, there is no underlying identifiable cause. Right? We call it as idiopathic. There is so the incidence of primary OAB has been found to be more in an anxious individual, a patient who feels stressed out in life, and primarily an anxious person. The incidence of primary OAB is high. Maybe in such group of individuals, a relaxation technique will help in their overall well-being and reducing their anxiety as well, and bringing their incontinence episodes also under control.
Okay. So relaxation therapy is helpful for the treatment. Of course, when your mind is relaxed, obviously, you can have a better lifestyle. Sir, taking the next question, and it is by Sebastian. He's asking, is overactive bladder or urinary continence fully treatable?
Yes, Sebastian, is completely treatable. So the first and foremost is the awareness. So programs like these and really tend to educate the viewers about that there's a condition called overactive bladder, and it is not too abnormal to leak urine, but it's completely curable once they seek medical attention. So the whole idea of this World Incontinence Week is to create awareness. There's an International Continence Society which which celebrates this World Continence Week in every year in the last week of June. So overall, there should be an awareness that it is a commonly treatable condition, and it's a completely curable one as well.
Okay. So it is treatable, of course, and you have the guidance of a urologist, then there is no need to worry. Okay. So next question is by Ankur. He's asking, if someone is leaking urine during laughing or sneezing, then how he should deal with it?
So this is stress urinary incontinence. Yeah. So this is not OAB. This is a separate condition. It comes under urinary incontinence, but it's not overactive bladder. This is a stress urinary incontinence. So again, one needs to find out, if he's Sebastian asking about women, then it is quite common for stress urinary incontinence to have in women quite naturally, particularly in the post-menopausal age group. Having said that, even men can have stress urinary incontinence, but this is extremely rare. And this is usually when they had a urological procedure like in a prostate-related surgery, or they have had surgery, pelvic surgery for prostate-related cancers, or they have an underlying neurological condition. So only in those cases, a man usually experiences stress urine leak. But in the case of women, even without an underlying cause, they can have stress urinary leak, which is also controllable to a certain extent with medications. If not, there are simple surgeries which can completely get the stress under control. These surgeries are usually performed as a daycare or as an outpatient procedure. The patients may not stay overnight in the hospital and can get discharged the same day. It's a very simple procedure and gives very rewarding results.
Okay. Right now, everyone is stressed because of coronavirus. So obviously, the chances might be more, but there's no need to.
This stress is different from that stress, Varsha. So we're not talking about the general stress. Usually, that doesn't lead to urinary incontinence. The terminology is called stress urinary incontinence because it increases. We relate to activities like coughing and so on and so forth, which causes the stress urine leak.
Okay. So the answer, I hope, is clear now. The dietary habits we have already discussed, David, in the live. Okay. Sir, how much is the duration for this treatment actually? If somebody is starting the treatment now, so how much time will it require for him to get complete cure for this problem?
So in most cases, the symptoms are usually primary overactive bladder is usually transient. Yeah. So, but these medications, like I already mentioned, the effect doesn't start overnight. So usually your urologist will prescribe these medications for a minimum period of 2 weeks, 2 to 4 weeks, and can go on for about 3 to 6 months. But he will call you periodically, review your bladder diary, and review how you're feeling symptomatically better, gradually taper the dose of medicines, and probably stop once your symptoms are well under control. But it's very prudent that you should not stop the medicines on your own, but should only do it at the advice of the urologist.
So with this, I think the question of Mohammad Rafiq is also covered because he has just now asked when we should stop taking the medication. So you should stop taking the medication only once your urologist is suggesting you to stop it. Please don't stop on your own. Okay, so this answer is also clear, I guess. Sir, urinary incontinence also has some psychological effect on us, that we stop going to a public place or meeting or interacting with people. And it is it's affecting our self-esteem as well. So what would you like to suggest to these people?
See, that's the most crucial aspect of urinary incontinence, So it's a huge stigma on the patient's well-being, overall well-being. From a physical point of view, if they have to leak urine or go to the restroom far too often, they will feel a sense of tiredness, a sense of perpetual tiredness. And an elderly person, if he has to use a washroom often, there can be episodes of fall, which leads to secondary problems like fractures and so on. So it primarily affects the physical well-being, and it can also have they can have skin rashes around the genitals and so on. So primarily the physical well-being is affected. Second is the emotional well-being. They don't feel normal about themselves. It can have an impact on their social life, and they will always have a fear of when they will leak urine. So what the public will think about it, because sometimes there can be foul smell, and it can be easily diagnosed that if this person comes near to you, you will experience this foul odor. So these kind of things, they will contain themselves in a shell, and they will be so restrictive to go to public places. Or even if they have to travel, they will have this fear that they will want to find out where is the nearest restroom that they can use. So for that fear, they won't travel far too often. I can also have an impact on their sexual well-being as well. So, and if a person is of the working age group, so that can have a big effect on their workplace environment as well. The efficacy of work will also come down. So it affects the overall well-being of an individual. So it is very prudent to seek medical attention because it affects the overall well-being.
Yes, of course, that is there, because you feel a lot of you go through a lot of emotional trauma when you have urinary incontinence, and the only suggestion is, as soon as you see any symptoms, please go and take suggestions from a urologist, and then the problem will be cured. Okay. So all these questions.
I need to add on, add the role of family support is also very, very crucial in this regard. Like, you see your mother or your wife, go into the restroom far more often than they used to, or, because your family is the first point where the patients might open up with their problem, So, but usually the patients, they might, feel it is normal, or they will try to ignore and keep it contained. So it is the responsibility of the family member to bring the father or mother to a urologist or a clinician to seek medical attention. The role of family is very, very important.
Yes. So the family members also need to be very attentive as in when you are seeing such symptoms. Okay. Sir, you have mentioned about bladder diary earlier. Sir, can you please elaborate it once again?
Okay. So a bladder diary is a very simple tool to maintain, but it gives a very useful piece of information to diagnose the underlying condition, and also helps in prescribing dietary and lifestyle modifications to the patient by the urologist. So basically, the bladder diary is nothing but you will have to note down the time and the quantity of fluid that one is intaking. Yeah. And also measure the amount of primarily the time interval at which one is going and using the restroom, and if possible also measure the amount of urine that one is expelling. If that is not possible, at least the frequency at which one is using the restroom needs to be noted down. So for example, we were discussing about nocturnal polyuria, that is where the patient is having to pass urine more so only in the night. So if you look at the bladder diary and you find that that patient is taking more amount of water after 6 p.m. and after emptying his bladder each and every time in the night, he's taking about 100 ml of water. So just by advising him to restrict the fluid intake can itself control his nocturia. So in that regards, the bladder diary gives a very useful piece of information. Also, the incontinence frequency will also be mapped in the bladder diary. So apart from going to the restroom to pass urine, if he's leaked urine, even that needs to be documented in the bladder diary. So once you start the treatment, whether his incontinence episodes has come down, can also be deciphered from the bladder diary.
So I hope this is clear. The bladder diary, you can maintain and document all the things that you are like eating, you're including in your diet, and the times when you're going for urine. All these things you can do. Okay, so we have taken almost all the questions. In the end, what would you like to say to our viewers in the World Continence Week?
Okay, so urinary incontinence is a vast topic. I think we tried to cover certain portions of it. So the primary focus was on overactive bladder because it's it's one condition which affects all age groups. And we also spoke about stress urinary incontinence, which is usually secondary to some underlying condition in the male and in elderly females. So basically, it is a right of every human being to control his or her urine. So if you are experiencing incontinence episodes, so don't hesitate, please seek medical attention. It is completely curable and controllable. I think that's a big message we need to give to the viewers.
Yes, there is no need to worry. It is curable. If you find any symptoms, go and take the consultation from a urologist. Thank you so much, sir, for solving all the doubts of our viewers and for giving such an informative session. Thank you so much for your time, sir. Thank you.
Thank you so much. Thank you.
And thank you to all our viewers for being so patient and asking all the questions. I hope all the questions are answered and you have got the answer to all your problems. We will see you soon in the next session. Till then, take care. You can follow us on our FB page. We come by the name of Bladder Wellness. And you can follow us on YouTube, Twitter, and Instagram by the same name, Bladder Wellness. Take care. Have a good day. Once again, thank you, sir.